Good evening again. My name is Naita Wigington, and I have the privilege of serving as the host for today's conversation. I have the privilege of working with a wonderful team at the Kentucky Department of Veterans Affairs. I will shortly introduce the members of the team only after we have introduced you to our dynamic leader, Commissioner Keith L. Jackson. Commissioner Jackson is a native of Kentucky, Lexington, Kentucky, as a matter of fact. He is a graduate of the University of Kentucky, and he has a 27-year career in the military. Please know that many of you who are on this call will better know him as Forever the Chief. He was Lexington, Kentucky's first African-American chief of police. Excuse me, I'm sorry, did I say that, Commissioner? He was the chief of the fire department, and he is still putting out fires when it comes to our veterans. When there are challenges, he's got them. When there are new safety controls we need to know about, he's got us. So once again, he is still forever the chief. In his capacity with the Department of Veterans Affairs, he is the #1 advocate for veterans and their families in Kentucky. Please know that we celebrate his many awards and accomplishments, none of which are as great in my mind as one that he periodically says here and there in an humble way, that when he served in Iraq, he lost no man or woman. His entire team came home. What a blessing that is. And he is trying to make sure that every veteran that here in Kentucky calls the Commonwealth home is able to get everything that he or she deserves. And he needs your help in helping them do that. I will now turn it over to our commissioner. Thank you.
Man, Naida got me in here think I'm a preacher or something. So that's one of them introductions that a reverend deserves. I'm just a humble commissioner. So I want to thank everybody for tuning in this evening and listening to our message about the Kentucky Department of Veterans Affairs. One of my mantras in life is opportunity is the great equalizer. And so as we go through this message today, I want you to know that our message is universal across all the veterans and the families of veterans in the Commonwealth of Kentucky. And we want you to learn about our benefits, opportunities, and the potential to enhance the quality of life of those veterans that have served this nation. And I want to slide real quickly before I introduce Major General Vereen. And there he is, General Vereen is with us. But this is a quote from the new Secretary of the VA. And it begins with, every decision I make will be determined by a simple principle that increases every veteran's access to care and benefits and improves outcomes for them. And that is our focus as we go forward with everything we do within the Kentucky Department of Veterans Affairs. We're a state agency, but our focus is to ensure that every veteran has an opportunity to get those benefits and opportunities for healthcare that they deserved and earned for serving this nation. Now I will slide into the introduction of Major General Kevin Vereen. I have these long notes, and a man that has served his nation like he has, and I've known him over the last 6 months, and everything that I have learned about him are summed up in a few words, and I would say tenacious, forthcoming, deliberate, focused, and dedicated to the United States Army. He is the commanding general of the U.S. Army Recruiting Command at Fort Knox. And he actually reached out to me. and that's how much he wanted to be a part of what's going on in the Commonwealth of Kentucky. And he has been working with us in developing a skill bridge program. He's also working with the governor and his staff in recruiting police officers to the Commonwealth. he is a true warrior, and he's also one of my fraternity brothers. So it warms my heart to bring him before you today to give us a few words about what it is to be a soldier and a warrior, and what it is to that he has in store for us as veterans that have served. So with that, I'll turn it over to Major General Kevin Vereen.
Okay. Hey, can you hear me? Okay. All right, good. Hey, Keith. So first of all, I do want to thank you for allowing me to at least, talk to you all tonight. And I know, I think I saw Whitney on the line as well. So, I really appreciate you all in all that you do. And I see a couple of familiar faces on the screens too. So it's good to see people that I'm familiar with, JC and Sergeant Major Thornton Noel. I see her too. So again, it's an honor for me just to talk to you just a few minutes. I don't, being the guest, this special guest, I don't know what I'm supposed to say, but I'll say something. But I won't be long. I guarantee you that, because I want, I know it's dialogue back to you, inside the the Zoom system. That I think that's where the great sharing of information will occur. So so first of all, thank you all for for attending and being a part of this tonight. I do think it's important that we get an opportunity to be able to dialogue, and especially with veterans. So not to make it all about me, but I'm well aware of the veterans programs, having a father who served and benefited from the VA and all the state of North Carolina veterans benefits that he was afforded as a post service member. And then also my brothers both have served, and they're currently benefiting from the veterans programs that are in the state of North Carolina. So for me, I think what we do for our veterans, and I will tell you, across America, is really, to me, I think it's a great opportunity that that our nation can give back for those who serve. Make no question about it. Every single opportunity, I think that service members that are currently serving in uniform have the opportunity to interact with our veterans. I mean, it is a powerful, it's a powerful opportunity, a powerful, engagement, because we know that, in some cases, we who are currently still wearing a uniform, we couldn't do what we do if it wasn't for our veterans and those who have served in the past, and those who are still intimately involved in ensuring that our Army and our military remain strong. That is extremely important for us. Keith mentioned a little bit about our partnership that we've been able to kind of generate over the last 6 months since he became commissioner. And I was able to arrive here at Fort Knox, Kentucky, and I can't say enough about his receptiveness of our ability to reach out, and our opportunity to reach out and forge a relationship between the Kentucky Department of Veterans Affairs. And I think it's not only being able to look at what opportunities exist across the state of Kentucky, but there's a couple things I think that we are working that I think you all need to be aware of, and if you could help us in this venue, will be awesome. I think my opportunity here as the commanding general in the state of Kentucky is to really, as we look at what opportunities exist for our veterans that are retiring, for those who are currently serving and will go back, to our communities in the state of Kentucky, it's really about equipping them so that they can be value-added members in their communities. A lot of our veterans will leave with a wealth of educational degrees. They'll leave with certifications and credentialing, which is extremely powerful for our military members when they go back and look for opportunities to and seek employment opportunities in the state of Kentucky. I think that is extremely powerful, and Keith and the team have really helped me to kind of navigate through through opportunities that we can explore together. I am a military police officer by trade, so he talked a little bit about the relationship that we've been able to forge and looking at growing law enforcement officers across the state of Kentucky through our service members who serve as military police soldiers who will eventually either get out after their term of service or retire and want to seek some opportunities back in law enforcement. And so whether it's, State Highway Patrol of Kentucky or, working in one of the cities in Kentucky, that is really what I think what we're trying to move forward to try to give opportunities for people to look at the state of Kentucky and know that there's opportunities for them to be able to work and thrive in their communities. And so we're looking at opportunities in that venue. And if it wasn't for Keith and Whitney and some of the leaders there with the Kentucky Department of Veterans Affairs, we probably would never have gotten this thing off the ground. But thankfully, we have done so, and we're moving forward. I do think that it's important that I talk about a little bit about getting your help. And every time I get the opportunity, I'm asking for help because our veterans are critical to what we do when it comes to recruiting across the United States Army. And we look at we call them enablers, every person who has a vested interest in growing the Army. We can use your assets and your ability to be able to help us break down barriers and break through in some cases, some challenging areas where we don't necessarily do well. And so I would just ask you if as you all are sitting here, if you have any, if you have any, ideas that you think that could help in our communities when it comes to talking about our military, you are our best advocates as well. I mean, a lot of you all have served, and kind of what service is all about. But we are trying to leverage our community partners, and you are partners in this whole. How do we continue to make our military strong? How do we make our Army strong? And I will tell you, I spent a lot of time talking to my commanders across recruiting about investing in community partners. And most of that investment comes from our veterans because they understand really what the Army and what the military is all about. So as we continue to partner with Kentucky Department of Veteran Affairs, I would ask that you freely reach out to me or anywhere in my command and ask, how can you help? Because it takes a community to recruit for the Army. And I say that all the time. It's just like raising our kids. It takes a community to recruit for the United States Army and the military. You look across our military and you see the disconnect. People will talk about the disconnect between those who have served as veterans and the current state of play. And you will see that the line of family lineage of those who have served in uniform is getting smaller and smaller. And so it's going to take all of us, I think, to be able to talk about, service in uniform and service and giving back to our communities and giving back to our nation and service in uniform. So I would ask that you just remember that. That's my plug for tonight. But I will also tell you that we are trying to do everything we can to return veterans who have served, those who have done a tour service in our Army, back to the state of Kentucky, back to our communities, to be able to contribute to their cities and their states, and do wonderful and great things for our country. And I do believe that this is a soldier for life concept. And that's what we really pride ourselves in. So without further ado, I'm done. I'm going to turn it back over to, I think, Nieta. I think she's going to take the mic, and then I'll turn it over to you for the next part of the session here.
Thank you so much, Major Vereen. You have done a great job in setting us up and the importance of us all working together and us remembering that we all play a part. So I'm going to borrow one of the sayings that our colleague Eileen Ward says. Eileen says that my entire life I was loved by a veteran. And I think that is such an amazing thing for us each to remember. Some of us here are veterans. Others have been loved by veterans. Other of us know the importance of having veterans in our lives. So as we begin this real dialogue, this real conversation, I want you to take a moment and think about what your role is and making sure that the 300,000 veterans and their families in Kentucky are sure that they are being served by the Kentucky Department of Veterans Affairs. I also want you to do this other thing. I want you to think about the individuals in your community who are veterans, who are the spouses of veterans, who are the widowers of veterans, who are the children of veterans, and make sure they are being served by the Kentucky Department of Veterans Affairs. We each have a responsibility. So my responsibility tonight with this wonderful host of individuals who are veterans, non-veterans, advocates of veterans from the public service organizations, including the Divine Nine, from the faith-based community, and from other groups. In the faith-based community, we have ushers. I'm going to be the night's usher. The usher makes sure that you know what the program is, what time we start, and what time we're going to end. So I promise you that we're going to do our very best to get out 7:45. Let's say that. 15 minutes over what our estimated time was, right? And we're going to make sure that if you need to stay a few moments later, like in my childhood church, you stay around and you talk a little bit more to get some more love, to get some more information. We're willing to allow you to do that too. And then at a certain point, we say, you know what? You really need to go to talk to Miss So-and-so or Mr. So-and-so. They can really help you. And so we're going to make sure we do that as well. So what you need to do at this point to make sure it's a true conversation is take advantage of the chat space. Write in your questions. Know that when I introduce the colleagues who the commissioner is wonderful for saying no one works under him or for him, we work together. So right now we are getting ready to demonstrate how we work together to serve you on behalf of the governor, Governor Andy Beshear. We'll take this now opportunity to briefly start to ask questions, introducing the team. Before I do that, I must take advantage of acknowledging one of our honorary KDVA members, the Honorable Representative Stevenson. Would you like to say hello briefly?
I don't want to, I'm sorry, I'm tongue-tied. You caught me by surprise and my family's not used to me being tongue-tied. But I just want to say thank you for the work you do. Thank you for loving us. And thank you for being the difference that this nation counts on. There's just nothing this nation could be without us. And because we served, or because we were loved by a veteran, we now get to reach the promise of America. So thank you.
Thank you so much, our veteran, our representative. We'll now go to introducing Donna Scrivener. Donna is a veteran. She is also the Director of Benefits. Donna, if you can give us a brief introduction to your department, and then we're going to follow up with a question. The questions I will follow up with are questions that were sent in by individuals who registered for this event. Thank you, Donna.
Thank you. I'm going to share my screen just so you all can see what my division does. I hope you all can see what the benefits division, there we go. Okay, so benefits division is probably the most rewarding division, at least in my opinion, because we get to help people access all of the benefits that their service entitles them and their family members to. Now, most of the benefits come from the Federal Veterans Administration. And a lot of veterans get confused because there's actually 3 separate veterans administrations that come under the Secretary of Veterans Affairs. We have the Veterans Health Administration. That's what you think of when you think of veterans hospitals, medical care. those sorts of services. We have the National Cemetery Administration, and that's what we think about when we talk about our federal cemeteries. And then we have the Veterans Benefits Administration, and that is the branch that I work most closely with. And they're the ones who administer the benefits that we most typically associate with the things veterans ask about, like home loans, educational benefits, employment assistance, life insurance, the actual monetary burial benefits. And then most critically, and this is what my folks spend most of their time on, is disability compensation. And that's when the VA pays you for a disability that is the result of your military service. That can range from 0%, where the VA acknowledges that you have a disability from your service and you get free health care for that condition, all the way up to say 100% if you had, say, a cancer that's related to your exposure to Agent Orange while you were in Vietnam. And it's anywhere in between. And it's very individual. So one of the things that my staff does is sit down with veterans one-on-one and go through the specifics of their service and help them identify those conditions that are currently diagnosed, that began on active duty, and that have been chronic problems since service. In those situations, the VA will grant service-connected compensation. And I always like to take a second just to say that there is a misconception out there among veterans that you have to fight the VA to get your benefits, that it's an adversarial relationship, and nothing could be farther from the truth. The VA wants to grant benefits. When I first started working as an advocate, I remember going upstairs to the regional office in Louisville and seeing a giant sign that says, "Grant if you can, deny if you must." And that is absolutely the heart and soul of the adjudicators that are there making the decisions about these benefits. And I'm really excited to see that Robin Grant is here. She is the Assistant Veteran Service Center Manager at the Louisville Regional Office. And we have an incredible partnership with the VA. If I have a veteran that is having an issue that I can't resolve, that is under the auspices of the Veterans Benefits Administration, the service center manager, the assistant service center managers, the coaches at the regional office will bend over backwards to do what needs to be done to ensure that whatever the impediment is to benefits gets resolved. So service-connected compensation is the bulk of what we do, but there's also non-service connected pension benefits. You hear a lot of folks on TV talking about aid and attendance, get your aid and attendance benefits. What that really is a needs-based income supplement for wartime veterans and the unremarried widows of wartime veterans. So if we have a veteran who has wartime service, limited assets, low income, or limited assets, and their income is being completely consumed by medical expenses, they quite often will qualify for a non-service connected pension. And my folks will provide those services. And one thing that's really important to note is that you should never, ever pay anyone for assistance in filing claims for compensation or a pension. Everyone in my division is accredited with the Veterans Administration. That means that we've been trained and tested and certified, and we undergo regular training to stay on top of changes in benefits. And we are there to help you navigate the claims process. And I have 21 field representatives and 3 regional administrators. They're spread all over the Commonwealth. And there is one that serves the area where anyone in Kentucky lives. And we'll actually, help folks that are over the border too, if we're the closest source of assistance. So I think it's important to realize that. And then although the VA rarely makes mistakes, they do occasionally make a decision that we disagree with, and there is an appeals process. I have a full-time appeals manager that helps veterans go back and revisit those unfavorable decisions, and we do everything we can to help change the VA's mind.
What a
Now,
wonderful job you do, Donna.
it's a lot
I
of
mean, you are just doing so many amazing things. I have a question for you.
sure.
If I want to learn about the benefits that I have earned as a veteran, or that my spouse has earned as a veteran, and that I may get because I am the spouse of a veteran, what do I have to do?
So there's a couple of things. First of all, the veterans, the Louisville Regional Office, the Veteran Service Center, has graciously offered to do a specifically tailored veterans benefits briefing that will cover specifics of eligibility and application for VA compensation and pension. And that will be held at Monday, April 19th at noon. So it's kind of a lunch and learn format. There's a Zoom link on my slide, and there's also a telephone number with a conference code. Really would like you to spread that information out as far as you can. Anyone who's a veteran or has a family member who's a veteran should tune in, listen to what the federal VA has to present. And then my staff will also be on that call. And
Donna, let me ask if you'd be so kind as to do this. Unfortunately, we're not able to see your slide.
You can't, I thought I had that shared.
Unfortunately, we're not able to see it.
Okay, so
would you be so kind as to call out what your contact information is?
Sure. Okay. I thought I had tested that screen.
Accidents happen.
Got it. Okay.
We're in the technology world right now.
Right. Okay. So
there you go. We've got it now.
Got it. Good. Okay. So my email is donna.scrivener@ky.gov. But the Zoom link is there. And if you want to, you can email any of us and we can forward the Zoom link to you. And then also the telephone number for the call is 713-353-0212. And the conference code is 971270. Now, I will have field representatives and regional administrators on that call. So if you listen in on the call and you say, hey, I really would like to talk to someone one-on-one, we'll get your telephone number and we'll have a field representative call you and set up a one-on-one conference, because so many benefits eligibility issues are veteran specific, situation specific. So it's hard to answer a lot of benefits questions generally. So
that's awesome.
Okay. Now there is one other benefit that I would like to just quickly cover, and that is the Kentucky tuition waiver. This is a program that is managed by my division. And this is a program where the dependents of veterans who are 100% service connected or on a non-service connected pension, veterans whose death was related to their military service, or even just Kentucky veterans who had wartime service. Those dependents are eligible for 45 months of free tuition at Kentucky state-funded colleges and universities. There is an unlimited waiver, which if you apply and you qualify for it, we'll let you know. But pretty much it's 1 degree until you turn 26 for children. And it is does not include room and board or books and fees, but it's still an extremely generous benefit. And if there's any question at all about whether or not you are eligible for a waiver, we would invite you to submit the documentation in the application and let us see. And then our website, www.veterans.ky.gov, has a page that has all of the information and the application for the tuition waiver. So we would really like everyone to take a look at that and ask the question, am I eligible for that?
Thank you so much, Donna. We appreciate that. We're going to now ask a couple of more questions, and I want us to know that I am not trying to rush anyone. Donna has a lot of information. She has good information. She has great information. And if you don't do anything else from this call, you and your loved ones need to schedule a consultation with Donna and her team. Donna and her team will make sure that you are able to connect with everyone on the KDVA staff who is here to support you. So please take down Donna's information, keep it, and share it with those you love. All right, so one of the questions that we get, if you want to take advantage of the services and support that is provided by KDVA, one question we received, and it's a question that KDVA often gets, and it's a question that we need to get settled. And that question that came in from a registrant is, how do I know if I'm a veteran? I served in the reserve. I never went to combat. Am I a veteran? So we're going to ask Sergeant Major Lanice Noel to please answer that question.
The short answer is yes, you are. But what is a veteran? Let me read you what the Title 38 of the Code of the Federal Regulation defines as a veteran: as a person who served on active duty, military, naval, or air service, or who was discharged or released under conditions other than dishonorable. So you have to have an honorable discharge. This defines and explains that any individual that complete a service for any branch of armed forces classified as a veteran, as long as they were not dishonorably discharged. So again, the short answer to that is yes, you are a veteran. I know it was some questions for some time about whether you was if you was a reservist and or a National Guard, that was you considered a veteran. We got it. In 2016, it was official. It was officially announced and the change was made that U.S. Guard and Reserve members are officially veterans. I want to just also add, now that's saying that you're a veteran, but your entitlements, what are the applicable benefits and entitlements that you get? Now that you have our subject matter experts on the line, they're going to assist you with that. And I will ask you to determine what you get and what you don't get. So I'm not going to give you the answer to that just yet, because I have subject matter experts that can help you assist with that. But if you could help us so we can get to all of you all, if you feel comfortable, please go into the chat, put your contact information and put your question, and we'll get back to you as soon as possible. We're looking at the chat box as we speak and as everyone's speaking, and so we will try to get your answer. But it's case by case. We got to get some information to determine what you are exactly eligible for and what your entitlements will be. Thank you.
Thank
Back
you
over to
so
you, Mia.
much, Sergeant Noel. So Sergeant Noel is the fellow in chief of staff. And as our commissioner and our deputy often tell us, she's a bad sergeant major. She has been responsible for HR all over the country for the United States military. So we are honored to have us with us at KDVA as a fellow for chief of staff. We'll now need to switch over to our colleague, Candace Bradley, who is a veteran. Candace is responsible for our legislation. And it's important that we talk to Candace at this particular time, since we just had the question about benefits and are we applicable for them? And much of that is decided by legislation. Candace, will you share with us, please?
Sure. Yeah, thank you, Naida, and thanks everybody for being here. This is great. What a wonderful turnout. And we do have our representative, Stevenson, and I'm so happy to see your face. She's been a wonderful advocate for Kentucky veterans, and now in this new role has a huge opportunity to make some law changes in favor of veterans and family members. So that's wonderful. As Naida said, I serve in a couple different roles within the agency. I'm going to talk about the legislative liaison portion now. We have over the years advocated for state level laws that help benefit our Kentucky veterans. And so some of those are the tuition waiver that Donna was just talking about. Mark's going to talk about the nurse repayment plan. Representative Stevenson was an incredible advocate for us in this last short session and was able to get our reorganization pushed through. So that was absolutely wonderful. And what that's going to do is give us the resources to grow at the rate that we desperately need to. So just, we're working on another legislative item that we have is expanding the tuition waiver for Donna's folks. For Kentuckians. And we are also working on a suicide prevention program within our agency. We know how important that is to our family members and veterans. I also serve as the Governor's Challenge co-lead, and that's a 2-year initiative that we've been working on to put actual metrics and initiatives within the state that can be maintained for suicide prevention. So one of those initiatives I think Naida wanted me to touch on was the Purple Star program. And so what that does is within the schools, we identify one teacher that goes through a targeted training that is related to veteran issues. And they get a certification and they get a Purple Star put on their door. So kids know that they can physically go talk to this person about veteran issues. But there's lots of different things that we're working on within the Governor's Challenge. And I did want to hit on the fact that you do have 2 federal medical centers that are VAs in Lexington. And those are the numbers that you can call to get enrolled in VA healthcare. And if you're a veteran, then you can also get your COVID shot within each of those locations. But thank you, on mute, Naida.
Myself, thank you so much, Candace. So Candace, I do have a question for you that has come in from one of our individuals who had the opportunity to pre-register. And that was, I am specifically interested in any movement in Kentucky to exempt military retirement pay from taxes. Otherwise, Tennessee may be where I retire.
Wow, you threw that one in there on me, but it's important. And listen, we are absolutely advocating that we can be competitive with the folks that are coming out of Fort Campbell. We want to make sure that their retirement exemption happens. So, you know, I'm pretty new in this role, but I know that we've been advocating for that tax exemption for at least the past 3 years. And so if that is something that you're passionate about or for, which I think every person, regardless of if they're, you know, attracted to a veteran community, it's good for our veterans, it's good for our state, right? So if you feel so inclined, please contact your representative to see how we can get that passed.
Thank you so much. So Candace has just given us one call to action. If you are interested in supporting veterans, not having to pay taxes, we don't want to lose our veterans to other states. We want to be able to love on and support them in the Commonwealth of Kentucky. Please support Candace and her efforts, and her contact information has been given, and you know who your representatives are. If you need any assistance in finding out how to contact them, please do let us know. We will assist you. One thing that Candace did share was a program about teen prevention, of having stress and concerns about their life as a veteran family. We do have another question that came in from a pre-registration. What does KDVA do for families? So Candace just shared one stress relief, but there's another stress that families have, and that's employment. So we're going to now switch over to Monica. Monica, who is the spouse of a veteran, Monica A. Cobb, and I apologize, Monica, if I say your name wrong. It's not from my heart, it's from my head. I need you to please share with us about your program and how you can help veterans in terms of their needs of employment and when they are underemployed. Thank you, Monica.
You're welcome, and thank you, everyone, for allowing us to speak tonight. It's such a pleasure to be here with everyone. And General Vereen, I'm going to tell you, sir, we're working on those 31 Bravos to get them in a skill bridge program. KDVA, the actual name of the program is the Kentucky Veterans Employment Training and Support Program, otherwise known as KY-VETS. We're here to provide resources and to support and to assist our veterans across the Commonwealth in gainful employment, and to collaborate with other state and federal agencies with regard to veteran employment, and through an understanding and walk them through the barriers they faced in finding that employment. As the program administrator, I offer guidance to employers on the opportunity to access and leverage the world's most highly trained and motivated workforce. That's that of the U.S. military service member. I also am working with some of the other state agencies on the Skill Bridge program. I'm very excited about that. That is one of the most untapped resources that our veterans have today that they sometimes don't know about. It not only benefits our veterans, it also benefits the employers that bring them on. So that's a big push. And it's so good to see Sean Adams here. He is an advocate as well for the SkillBridge program. And in fact, we're working with the SHRM, Kentucky SHRM, which is the Kentucky, the Society of Human Resource Management, along with the Chambers of Commerce of the state, to get the word out about our SkillBridge program and what we can do for our veteran community.
That is awesome, Monica and Sean. We so appreciate the work you're doing. And because we know there's some individuals on this call who are not veterans, but who are advocates for veterans, can you please explain what is the SkillBridge program?
Absolutely. The SkillBridge program is a program that's ran by the Department of Defense. Any of the veterans who are 180 days of the military service can go into what's called the SkillBridge program. That allows them to go out into the workforce and work for a company to train in the civilian workplace. That allows them to learn a new trade because let's face it, there's not a lot of jobs out there for a sniper. So that allows them to get that training that they need and deserve. And it's no cost to the employer at all. It's a free program to them. The veteran is still getting paid. They do.
Thank you so much, Monica. So we just heard there's a wonderful opportunity to make sure that we can assist our veterans in being employed. But we know in our life experiences right now that sometimes it doesn't matter if you're working, you're still not able to make your ends meet.
Absolutely.
Sometimes that you can work very hard and your hardest efforts still leave you a penny short, right? And a day late. So I want to introduce you to Eileen Ward. Eileen Ward handles our homeless veterans program. She assists veterans who are homeless, and listen to this, homeless or at risk of homelessness. At risk of homelessness. Donna will also help you with those benefits. Donna will connect you often to Eileen. Eileen often connects you to Donna. So at this particular time, we'll have Eileen, who has always spent her life loved by a vet. So please share with us. Thank you, Eileen.
Thank you very much. My name is Eileen Ward, and as Naida mentioned, I'm the Homeless Veteran Program Administrator. So we do have a financial grant program that provides direct financial assistance from $350 to $500 to veterans facing eviction or essential utility disconnection. So the question before was what kind of service? I don't, Reserve, National Guard, full-time active. As long as I have a DD 214 and it's just from basic training, that's fine. But it must be a discharge that's other than dishonorable, low income. So right now, a single veteran making less than $1,610 per month, and that does adjust for family size, they would be eligible. I would just need proof of the immediate need. I would need a copy of the disconnect notice or the eviction notice, and I can take care of that. So that's why my contact information, please write that down and share it with anyone that you know that's having financial difficulties. So the other part of my program is I direct homeless veterans and their families to the appropriate federal, state, and local agencies that can assist with housing, clothing, food, anything, employment assistance, anything that they need. Excuse me. So KDVA is also in partnership with the Kentucky Department of Agriculture. They have a senior farmers market nutritional program that provides $28 in checks to purchase fresh produce. And they're starting this pilot project in Fayette, Madison, Hardin, and Christian. It's very simple. It's not just for veterans, by the way, but they're wanting me to promote it in the veteran community. But you have to be 60 years old plus 1 day. You must be able to provide proof of your age. and then proof of income, which is self-reported. So for a single veteran, if you make less than $459 a week, or a married veteran, for the couple makes less than $620 per week, they will be eligible for that nutrition program. And also, this is brand new, and I don't even have all the information on it. We were told this in a meeting that the Volunteers of America was given a very generous grant by AT&T, and they have hotspots that they can provide to veterans and for school-age children.
You need to unmute, Eileen. Somehow you muted.
Sorry, where did you heard about the AT&T grant for the hotspots?
We heard the very beginning of it.
Okay, I'm sorry, I don't know how I did that. The Volunteers of America announced a grant they're working with. They're going to provide hotspots for veterans with school-age children, and that service will last for an entire year. That's very important. But contact me via email or phone number, and I'll get some more information on that. And I wanted to give one plug for Operation Victory. We have a coalition that we're part of that we work on rehabbing houses in Louisville. And it's really important because we're now taking applications for this program, but I thought it was extremely timely because the governor just signed House Bill 321 to create new economic development areas in West Louisville. And that's where these that's where these homes are. So please jot down that website. We are HPI. That stands for the Housing Partnership Incorporated. And please just go online and see if you qualify, or anyone that you know that would be interested in this program for veterans.
Thank you so much, Eileen. And I want to take the opportunity to give a plug for the Kentucky Veterans Program Trust Fund. The Trust Fund is a charitable portion within the state that allows you to support veterans. And part of that support goes to the Homeless Veterans Program Trust Fund. There is an opportunity for you to designate it to that. Please know that if you give a donation to the Kentucky Veterans Program Trust Fund, 100% of your donation goes toward veterans. Correct, 100%. There is no overhead. There is no additional charge. KDVA, as an organization, pulls that into their operations. They will pay for that, as opposed to you losing any of your donation. Also, if you purchase a license tag that says you support veterans or that you are a veteran, $5 of that purchase goes toward the Kentucky Veterans Program Trust Fund, which supports not only the homeless program, it also supports the Indigent Soldiers Program, and we'll learn more about that as we go. Before I go on, I do need to take this opportunity to introduce one of our guests who is on the line with us, because he is a type of program that supports the work that Eileen is doing, and that is the United Way of the Bluegrass. Mr. Timothy Johnson is with us on the call, and the United Way of the Bluegrass is going to add to their intake the question if someone is a veteran. So if they are, we can be sure to connect them with Donna to make sure they're getting the benefits that they so have earned. Mr. Johnson, would you like to just say hello and give a brief statement of how someone can contact you if they need support? Okay. I think we've lost Mr. Johnson. All right, well, just know that Mr. Timothy Johnson from the United Way of the Bluegrass was with us. We also have Barbara Kent from the Eastern Kentucky University. She does the Military Affairs program. She does a lot of work there with students, and they will be supporting the activities that Eileen does for homeless veterans as well. We will now take this opportunity to answer another question by introducing one of our members. And that question is, if I am the spouse of a veteran and that veteran is not doing so well, he or she needs full-time care, can you please tell me how he or she goes to a nursing center? I will now turn that question over to Mr. Mark Bowman.
Thanks, Naida. It's an honor to be with you all tonight, just like it's an honor for us to serve the veterans throughout all 4 state veterans homes in Kentucky. I want to avail myself, whether it's about state veterans home or long-term care in general. I was in the private sector for 23 years before coming here. So my email address is right there at the top. And we are proud to serve as a resource to veterans, veterans' families, and anybody that has any general questions. So I'm going to be fairly brief. Usually people contact us about accessing care for veterans. And what I've listed here for you is each of our locations. We have 4 facilities, one in Hanson, which is in Western Kentucky near Madisonville, one in Eastern Kentucky in Hazard, Radcliffe Veterans Center right by Fort Knox. It's a mile from the Gold Vault in Fort Knox. And then Wilmore, which is our biggest facility right outside of Lexington. You'll see listed there the admissions coordinators with their phone number and their emails, and you can call them, and they are experts in that field of admissions and eligibility and payment for those services. And they'll be glad to help you navigate through that very difficult process, because it's usually people are thrown into that situation. Nobody really prepares for it. And when you're thrown into it, it's very difficult to navigate. And these people are experts at it. Second to that, on our website, we have a button on the website that you can actually provide about 5 pieces of information, contact information, and one of those specialists will get back to you. So one of the things I always share with people, they always want to know what type of benefits for veterans that are specific to veterans. And one of the things that many people don't understand is if you have a service, 70% or above service-connected disability, you can come into a facility. They're skilled nursing facilities, and you can come into the skilled nursing facility and at no cost to the veteran or family. So the federal government pays us a per diem that covers all of that. I don't know if that's my feedback or someone else's, so I apologize for that. But the other thing is there is a level of care requirement. We provide skilled nursing facility care services. We do accept Medicare, Medicaid, private pay, and insurances. And again, like I talked about, 70% service-connected veterans are paid 100% by the federal government. The other thing we will always want to throw out is we have a lot of employment opportunities, career opportunities for people that want to get into nursing, social services, activities. We have, as you can imagine, with as many facilities as we have and the services that we have to provide, we have a lot of opportunities. So we're always welcoming people to join our team. Nida and Candace spoke earlier. One of the biggest legislative achievements that our division has had is we were successful in implementing the nurse loan repayment program. And what a joy it is for to be able to offer this for right now. It's for nurses, RNs, and LPNs. So they can come work for us, and after 1 year of eligibility, they become eligible for nurse loan repayment. The bottom line is over a 4-year period, if they meet the eligibility requirements, they can get up to $40,000 of their student debt taken care of. We pay that lending institution directly. And basically it's at a maximum of $10,000 a year up to 4 years. And that covers most bachelor degree debts in Kentucky. The average is about $32,000 to $36,000. So if someone comes and wants to serve our veterans and work, that's a big blessing to have that student debt repaid. And then last but not least, we can't do what we do without a lot of dedicated team members that we have that care for our veterans and the communities. The communities have such massive support for our facilities. We have a lot of volunteer opportunities. So anybody that's interested in getting involved in any of those communities, and we're getting ready to build a 5th one in Bowling Green, construction will probably start next year. We would welcome you to call and investigate some of those opportunities. Again, my name is Mark Bowman. It is truly a pleasure to serve the veterans of the Commonwealth and their families. And you can reach me and ask me anything you want to about long-term care at the email on that screen.
Thank you so much, Mark. I would like to take this 1 second to ask one of our guests who was on the call to share with us. We know that it's very hard to know that you have to trust your family members to someone that you don't know. You have to trust someone else to be able to take care of them and to love on them and make sure they get the medications they need, to get the support they need when they're in long-term care. I'm going to now ask Mr. Reverend Emerson, Wendell Emerson, who is a veteran, who has had a loved one at one of the nursing centers. Reverend Emerson, would you want to just share a brief testimony about the care that one gets that can maybe just ease the hearts of individuals who may have to take that leap one day. Unmute yourself for me, please, sir. Thank you.
Greetings, everyone. I thank you for the opportunity to share with you. Can y'all see this? This is what the Thompson Hood Veteran Center. This is Mr. Hugh Sterling. And believe me, my friends, my brothers and sisters, the Thompson Hood Veteran Center has done an excellent job with him and his care. Every time we go down to see him, we can see a smile on his face. And so I thank you. I thank the Thompson Hood. Thank you, Mr. Mark, and whatever y'all doing, and continue on doing it. It's a blessing to know that he is taking care. Thank you for everything. Have a blessed day.
God bless you. I actually know Mr. Sterling. He's a bundle of joy. So thank you very much.
Thank you, Reverend Emerson. And again, thank you, Mark, for all that you do. Now, as much as we take care of our loved ones during their time with us, we also know we want to make sure that we give them respect that they deserve at the time when they say their earthly farewell. And so I would now like to turn the conversation over to our chief, who is Al Duncan, who is in charge of our cemeteries. He is
Good evening, all. Hope all is doing well tonight. And my name is Al Duncan. I'm the division director for our 5 state veteran cemeteries. And I learned one thing in the Army of my 23 years. It's the 3 B's: be up, be brief, and be gone. So I'm going to be brief. Okay, so like I said, I'm the division director for 5 state veteran cemeteries. Where are those 5 state veteran cemeteries? On your screen, you'll see. Our first one there was in Kentucky Veteran Cemetery West in Hopkinsville. It opened in March of 2004. Our second one opened in 2007 in Kentucky Veteran Cemetery Central in Radcliffe. Our third one right there in the middle opened in 2008, Kentucky Veteran Cemetery North. A lot of people ask me where that is. It is exact midpoint between Lexington and Cincinnati on I-75, a little town called Williamstown. Our 4th cemetery opened in 2010. It is in Grayson, just past the town of Grayson if you're going east on 64. And then our newest one opened in 2018, and it is in Leslie County. Go down south I-75, turn left, jump on the Howell Rogers Parkway there in London, 42 miles, and you will run right into that cemetery. That is our 5 state veteran cemeteries. I just want to take a moment of your time, explain the difference. A lot of confusion out there. What is the difference between a state veteran cemetery and a national cemetery? Well, the only thing you really need to worry about is a national cemetery gets funded by the federal government. State veteran cemeteries get funded by the state of Kentucky, and that's pretty much the difference. Headstones are the exact same. The interments are done the exact same way. Your loved one, the care for your loved one at each one of our veteran cemeteries is the exact same. It's just who pays all salary as a state employee versus a federal employee. So with that being said, our state veteran cemeteries are free of charge. And what I mean by that is everything that happens at the cemetery is free for the veteran. You're going to go take care of everything in the nursing home, that is on the family. But when you come to when you roll through the gates of the veteran cemetery, everything is free. All perpetual care, the opening and closing, the headstone, the grave liner that the casket sits in, the military honors, everything that we do there at the cemetery is free for the veteran. For the spouse, we do the exact same thing for the spouse, except we charge a nominal fee of $500 for that spouse to be paid at the time of her burial or his burial, depending on which one is the spouse. So with that, there's a lot of different questions out there. And I would tell you this, at each one of those cemeteries, we have a branch manager. Most of those are retired first sergeants from either the Air Force or the Army. So I would tell you, whichever one is closest to your area, reach out to them, or you can reach out to me at that email address or my cell phone number, which is 502-229-2718. And I will get you linked up with that branch manager at that cemetery, and they can walk you step by step. And I will leave you with this thought, ladies and gentlemen. There is no rush. Take your time. We have plenty of spaces in our veteran cemeteries. Each one of our cemeteries right now are expected to be open for at least another 99 years. So there is nobody on this call that is going to outlive one of our state veteran cemeteries. So take your time, and we will be here when you decide you are ready to move on. With that being said, if there's any questions, I am here for you.
Thank you so much, Al. I do have a question. If someone wants to volunteer or to support with the cemeteries or with the work that you are doing, how would one do that?
They can reach out to me, or they can reach out to that branch manager at that state veteran cemetery. We always have things going on out there, washing headstones in the summertime, just little things, picking up trash, making sure that area is swept. If they're a veteran or not even a veteran, and they just want to spend some time out in the sun and help, reach out to me or one of the branch managers, and we'll work with you. If you have an organization that wants to come out and spend a little bit of time and help tidy up the area, by all means, we're here for you. Just get with us and we can make that happen.
Perfect. Thank you. One more question for you. And
Yes,
that
ma'am.
was, what if the spouse transitions before the veteran? Are they still able to go to the cemetery there?
Yes, by all means. Husband and wife will always be buried together, no matter what. We do a double death burial, so they'll both be in the same burial plot together. If the spouse passes first, she will be buried first, and then the veteran would be buried directly on top of her. So it doesn't matter whichever one. The veteran goes first, then the spouse, it's still the same. We will guarantee that the husband and wife are always buried together, whether it is a traditional casket burial or if it is a cremation, they will both be together. So any questions like that, feel free to give me a call, or send me an email, and then I can call you. My email address is right there at the top, alvin.duncan@ky.gov. So great questions. And if there's any other questions, feel free to fire away.
Thank you, sir. We are now going to take the opportunity to switch back over to Candace. We've had a wonderful discussion. We've learned a little bit more about being veterans and all the benefits and opportunities we have and how to get to them. But there's one group of veterans, more so than others, are sometimes out of the circle for veterans. And Candace does a wonderful job of being sure that we pull them in. And we all need to take our role as magnets to bring them back to the veteran world to get the services they so greatly deserve. Candace, will you please share with us more about the Women's Veterans Program, please?
Yes, thank you, Naida. And just listening to all the wonderful, knowledgeable things that my coworkers do on a daily basis, I'm truly humbled to be able to work with each of you guys and gals and to serve in any way that is possible. But I am currently also working as the Women Veterans Program Coordinator. And so there are about 25,000 female veterans in Kentucky currently, but our number's growing. And we want to make sure that these ladies have access to care and access to benefits. So we do targeted outreaches for women veterans. We ask questions about Donna's folks asked if they would like a male or a female to help fill out if they're going to be filing for any kinds of claims. We want to make sure that they have access to their health care. Really any benefit, whether it's state or federal, at either level, that they know that it's out there for them. So we also have a Have You Served campaign. It's a communications campaign, and we just want to make people mindful, females and males, that if you say, are you a veteran, as opposed to have you served, you could get a different reaction. So we want to make sure that, we're kind of mindful of that. And we also have a Women Veterans Listserv, where if there are specific activities that are going to go on, we get that sent out in an email blast. And we also have and this is just within our organization as a whole, not just targeted at women veterans, but we partner with the Federal Veterans Access or Experience.
Candace, we've lost you. Can you unmute? Somehow you've muted on us.
I don't know how that happened. I didn't even touch my screen. I'm sorry. Where did I lose y'all?
I can't hear you.
Can you hear me now? Can anybody hear me?
We can hear you now.
Yes.
Oh, okay. Okay. Where should I pick up?
So you were making sure that we had our women involved in all the programs and
Did I touch on have you served?
yes, you got
Okay,
have you served?
Wonderful. We have a Women Veterans Listserv email. So if anybody would like to be added to that, you can email me at the Candace.Bradley email or the Women Veterans. We want to make sure that we are getting the information pushed out that's being done nationally and on a state level to advocate for female veterans. We're also working on a Women Veterans Appreciation Day, June 12th. Which in 1948 was the day that was signed into law that women could serve in full capacity in the military. So we're excited to celebrate all of those wonderful things. And if you know a lady that has served in the military, please send her our way. We want to make sure to get her taken care of.
Thank you so much, Candace. So we just spoke about one group of veterans that we often lose, but we also lose veterans far too often to challenges that are legally involved, whether that be for some reason with the Veterans Court, needing to support them. We want to make sure that we are an ally and an advocate and a champion for veterans, no matter what they are going through. So we're going to take this opportunity now to speak to our Deputy Commissioner, Whitney Allen, who will tell us more about some of the support that we do for veterans who need a second chance.
Good evening, everyone. First, I would like to say it's great to see all of you here tonight, not only veterans and veteran family members, but as well as the center of influence and gatekeepers of the community. And just as General Vereen said earlier, if you can take our message and bring it out, get it out there to everyone, send them our way, we will take care of our veterans. On that, I'm just going to say a quick few words about the legal office. And the neat thing is we're around the corner, similar to what the commissioner says about his wraparound services. So our legal office is fall under the Office of the Commissioner, is headed by Attorney Janet Hall. His primary mission is to handle the affairs internally and externally of KDVA, basically keeping Commissioner Jackson out of jail. And if you look at him, he's a handsome man. I don't give him 2 days. Unless I'm joining them, we might make it a week. Okay, so Janet, we're glad to have you on your team. Keep us out of jail. But there's 3 interesting areas of initiative that her office does in support of veterans and the entire team. First initiative is veterans discharge upgrades. So all veterans should be leaving service with honorable discharge. But you know, sometimes people make mistakes and leave the military or been removed from the military because of unfortunate circumstances. This is where our office comes in and help coach either the veteran or their family members to get their discharge as close to honorable. And if you're asking like, why does it matter? Well, it's all about access. Honorable discharge gets you access to all the veteran services we just mentioned, and that's just at the state level, okay? And then there's the federal level. However, as you move away from honorable to like other and honorable, that limits what is entitled to you. So her office can help coach, teach, and mentor and refer to services. We will not defend, that's not our role, but we'll do everything we can to help get the veteran or the veteran families on that road. The second initiative is the veteran treatment courts. You know, there's veterans that are high risk their second chance veterans and vulnerable veterans. So the legal office is part of a bigger effort started by Commissioner Jackson with the other branches of KDVA, is to reach out to those veterans in the veterans treatment courts. Either way you look at it, as they're going in, there should be a benefit rep talking to them about their process, if they're about to serve time or go through a treatment and where they fit in that role. On the back end, when it's all done, we help them stay on their feet, i.e. Donna's team will reach out to turn on benefits again, make sure they don't owe anybody anything. Monica's there if there's employment needed, she reach out to our partners. So there's a wraparound love around those individuals when they go to the Veterans Treatment Court. And then the last part, or the last initiative here, and there's many, but the one I want to mention was thanks to Janet. Again, she makes sure that the Veterans Trust Fund program, which is a granting program by the states to support veteran organization and efforts of supporting veterans. So her office makes sure we're distributing funds, placing grants, or even receiving donations appropriately according to state laws and regulations.
Definitely, I like that push for the Veterans Program Trust Fund.
Yes, we need money. We need money.
So you all may see Janet on the screen. Janet is a newer member of the KDVA staff, so that's the reason why she is not sharing at this particular time. But she has already started to advocate and to push hard for everyone. And please know that the Veterans Program Trust Fund, if you go on the KDVA website, you'll see that there are opportunities for your organizations, your public service organizations, to apply for grants to serve veterans. Once again, 100% of all the funds go toward the veterans, or you also can have an opportunity to help raise the funds to go to our veterans. So we thank you for that. We're going to be very mindful, as was promised, of our time and of making sure that you are having input. All the questions we have asked thus far have come from our pre-registration guests. Some of them have also been duplicated in our chat. We have a couple of more questions to ask from our pre-registrants, and we're going to do that. But at the same time, I want to make sure that you are mindful of the chat at the bottom. If you have questions, please go ahead and make sure that you ask that question now, that you leave a way for us to contact you in case the conversation needs to be elongated. I'm going to take this moment now to ask a question that we received, and that was, how can veterans who are also farmers be supported by the Kentucky Department of Veterans Affairs? And I believe one of the colleagues would like to take that question.
I'll be happy to answer that question. Within state government and within the Department of Agriculture, there is an initiative called Homegrown Heroes. And so they get to put that sticker on their products that identifies them as veterans and veteran owned. So that's very important for folks that want to support veterans and businesses. So yeah, you can reach out to any of us at the state level within KDVA for more information or contact information, or the Department of Agriculture.
Thank you so much. And I do, with that question, I see that one of our guests today is Miss Ashley. Is Ashley still with us? Ashley?
Hello, yes.
Thank you so much. Hi, Ashley. Ashley is with Black Soil. So I would like for everyone, Ashley, if you could please put your contact information in the chat so that the veterans who asked that question can know to reach out to you, and that those who are here can also know how to reach out to you. Ashley, I'll give you a few seconds to share what Black Soil is and why it's so important for us to have this partnership with you.
Great. Thank you so much, Commissioner, all of the organizers, Naita. I do see some of our stakeholders on the call tonight, and I'm so glad that you took us up on the invitation to join. Black Soil is a statewide organization. We focus on agritourism. We work with Black farmers, chefs, and makers across the state of Kentucky. We've been around since 2017. And we operate in 31 counties. So we're really passionate about uplifting our farmers who are also veterans. The USDA Farm Census says that about 11% of veterans are also farming. So we want to absolutely promote the Homegrown Heroes program through the KDA and just continue helping our vets receive the products and the produce from the farmers market vouchers, as well as technical assistance so they can continue this incredible and critical sector and industry. So I appreciate the opportunity to speak tonight.
Naida, you're muted.
You're on mute, Naida.
Thank you. That's going to be like the big question, right? Are you on mute? Are you on mute? So I think, thank you, Ashley, for what you do and for our opportunity to serve with you. And I do want to say, Deputy mentioned if there was going to be any challenges with the commissioner. The commissioner has some individuals on this call who are veterans who have known him his entire life and have poured into him. And so, Deputy, you know, you took a risk with making that comment about the commissioner ever getting in trouble because he's a good boy in Lexington. See, people are shaking their head like, you don't come at the commissioner in Lexington. You don't do that. Just opportunity to have some joy and some laughter. All right, so we are now going to make sure that we turn over this conversation to John. Again, I mentioned John was our HR director. He has been wonderfully manning our chat, and he is going to now bring in additional questions that were brought in by our guest today. So I will now turn it over to him.
Thank you, Naida. I'd like to point out one thing before I start. The KDVA main phone number is 502-564-9203. The KDVA main phone number is 502-564-9203. And I've been also putting other contact information for different speakers in the chat box. So if you missed it on the slide, scroll down through the chat and you can get it there. First question from Beverly Bowens: are reservists entitled to all benefits?
The answer to that is it depends. Or actually, no, you're not automatically eligible for everything. If you were injured while you were on active duty or active duty for training, you can be service connected for that particular injury if it is still problematic today. And once you have a compensable rating, in other words, if you messed up your knee on active duty and you now have a 10% rating for that knee, that gets you entree into VA healthcare. So, you know, if you have a compensable rating, you can be enrolled in VA healthcare, where as a reservist without that and without active service, you would not. So that's why it's important to talk to one of our field representatives or regional administrators so we can go through your military experience with you and see if we can find, you know, claims that should be made for compensation that would then give you access to other benefits.
Thank you, Donna. The next question comes from Wendell Emerson. How about long-term healthcare benefits for veterans? Are all veterans able to receive VA benefits?
Yeah, I'll start this one off, and I think Donna can also add some. But from a Kentucky Department of Veterans Affairs perspective, our state veterans home provides skilled nursing facility level of care. There are other levels of care out there, but we provide only skilled nursing facility level of care. And as I mentioned before, anybody that has a 70% or more service-connected rating gets their care paid for. Any other veteran, if they qualify as an eligible veteran and are a resident of Kentucky, can gain entrance into our facilities because it can be paid for, like I mentioned earlier, through Medicare, Medicaid, private pay, or insurance. And what that does, even though there's a payer source that pays for that care, the VA pays us a basic per diem, a subsidy, to do a lot more for our benefits than a lot of the private sector facilities because we serve only veterans. And Donna, you might want to talk about the pension issue and getting the assistance.
Thank you. Yes. So for veterans who either do not meet the level of care for a long-term nursing facility, but need help in the home. If they have wartime service and they meet the other eligibility requirements for a pension, sometimes that income supplement can allow them to hire folks to come take care of them in their home and allow them to remain at home. If they're enrolled in VA healthcare, there are programs at some of the VA medical centers where the primary care provider can refer a veteran for assistance with having some homemaking services provided by contract to the veteran. There are lots of different options out there. And a good place to start is with your field representative or your regional administrator so that we can go over them with your specific eligibility and needs in mind.
Thank you, Donna. The next question comes from a Zoom user. It's regarding education benefits. Are there programs out there to continue your education once you run out of the GI Bill, or any programs to attain certifications of some sort to better yourself in the workforce?
So what we used to call VA Voc Rehab was vocational rehabilitation is now Veterans Readiness and Employment. So depending on what your eligibility for GI Bill was, if you have service-connected disabilities, we strongly suggest that you apply for VRNE and sit down and talk to a counselor to see if there are services that can be provided through VRNE. And then, of course, Monica, our employment specialist, is aware of programs that different employers are offering to train veterans to, move into jobs in their, specific work fields.
Monica, can you share with our audience what a person would need to bring when they are having a consultation with you in order to learn more about job opportunities? And Donna, thank you so much for that explanation.
Yes, our veterans would need to, oh, am I muted? I'm good. Can you hear me?
You're good.
Okay. Yes, veterans would need to bring with them, of course, a copy of their DD-214, because I want to make sure they're veterans when we serve them. Also, a copy of their resume, any degrees that they may have would be very helpful, and just a good attitude when they come in, and let's help find them a job. And that's pretty much what we need. And I can point them in directions. There's several opportunities for education out there for the veterans online. There's a lot of free training that they can partake in. So I would be willing and ready to help them.
Thank you so much. I'm going to turn this over to John for one more question. Then I have a pitch to ask Eileen for a question. And then we're going to have the commissioner give us our wrap up action item, our charge, our we can do this, we're all together, because we want to honor the statement that we were just going to go a few minutes over. And we've done that, and we'll continue to talk. We've done that. We've been sure to answer the questions that we received and that we are receiving, and we are offering the opportunity to come back. So as a good usher, I'm keeping the flow, and we're making sure that we got everything we came here for. So if you have additional questions, if you need someone to contact you, please put your name in the chat. If you don't feel comfortable doing that, please make sure that you call our offices on tomorrow and someone will assist you. We'll now have one more question. I have a pitch for Eileen and then the charge for the commissioner. Thank you so much.
Thank you, Naida. This question comes from Barbara Kent. Is there a residency requirement for the KDVA tuition waiver? And can an eligible veteran move from another state and their dependents be eligible for the tuition waiver?
Thank you so much for asking that question, because I forgot to put that on the slide. As soon as you get to Kentucky, you're a Kentuckian. So once you establish residency here by signing up for utilities, getting a Kentucky driver's license, as soon as you get here, you are eligible for the Kentucky tuition waiver. So if you're talking to a veteran who is 100% service connected, in another state and they've got kids that need to go to college or a wife that needs to go to college, tell them to come on to the Bluegrass, because as soon as you get here, you are eligible. And that is, again, 45 months of free tuition at a Kentucky state-funded college or university. Of course, EKU is one of our finest institutions and a wonderful home for anyone looking to expand their education. So yes, there is no minimum residency requirement, just the veteran has to move to Kentucky and then they're eligible.
Thank you, Donna. I'd like to remind everybody that our phone number is 502-564-9203, and our website is veterans, with an S, veterans.ky.gov.
Thank you so much, John. Now, this is our pitch to Eileen. I know that many of you are on this call are with faith-based organizations, or you're with public service groups, and you're always aware of the community's need. You know, it's not always money that you can give, but you can give time or you can give items. So I would like for Eileen to share, what can the community give you to support veterans and their families who are having challenges? We know the summer is coming up. There are going to be babies at home that need some additional help. We know that the holidays is not the only time to act like Christmas. So what do you need, Eileen?
Ooh, I was getting scared there. I didn't know what you were going to. Okay, so here's the thing. And I do this. We have a lot of veterans that are just newly housed. You know, they've been homeless for such a long time. So believe it or not, just the tiny things, I'm just went totally blank, like a shower curtain. If you don't have a towel in the shower curtain, so just the basic, I mean, if you're looking to do something to take up for a cause, you know, just basic home items, personal care items, just anything like that. And if you could make contact with us, I will make sure that they get into the hands of programs that are assisting veterans every day, especially the homeless.
Thank you, Eileen. So you all, she's got some work for your youth groups, your young adult groups, those new neophytes that you have coming on in here. There's some work to be done. All right, we'll now turn that over to our commissioner, Commissioner Jackson.
Hey, thank you very much for attending and supporting our event tonight. It was a couple of questions in there. I think you all answered. Somebody asked about our website. I think we published that. Our phone number, we published that. I think it was a veteran that asked, how do you get your DD 214? Just call us and we'll point you in the direction of the National Guard office right up the road from us, and we'll get you your DD 214. So with that, our call to action this night has told me that I needed to put forward was, our call to action is to take the information provided today and to utilize it to benefit yourself or your veteran or your family member that is a veteran. Because one thing that we want to do is we want to expand our footprint. We represent between 30 to 35,000 veterans across the Commonwealth, and my target for Donna is to get to 50,000. And then after that, we want to build on that, because we want every veteran and every veteran's family in the Commonwealth to get what they earned and what they deserved. And I give a personal example, and we'll try to get out of here no later than 8:02. Personal example for me is my dad, who was a Vietnam veteran, who died of the numerous cancers that came along with Agent Orange. And I have a great uncle who suffered from PTSD. He was a World War II and a Korean War veteran. And he died in a shootout with the police department. And we always talked about, as a kid, how Uncle Spencer was shell-shocked. And I can only imagine how he would have benefited if he had only entered himself into some of the programs that the VA offers. So Major General Vereen talked about the legacy of soldiers and sailors and Marines and National Guard and reservists. I can date my history all the way back to the Civil War. My family has always been a part of serving this nation. And so as I sit here today, as the commissioner of the Department of Veterans Affairs, I am humbled every day. And when I got this position, one of the things that I said that I was going to do was ensure that every veteran at least knew what the KDVA represented and what we were about, and to assist them in getting the benefits and the opportunities that this position afforded them. And I started with my quote for life is, opportunity is the great equalizer. And this is an opportunity for us to all have an opportunity to do great things for our families and for the veterans that have served this nation. My second charge is to give us the opportunity as KDVA to assist you and your family in viewing your records to see if you are entitled to benefits, healthcare, free federal at the federal and state level, whether it's working in one of our nursing homes or getting a job, or the end of life, the burial in one of our cemeteries. Our message is universal to every veteran and his or her family. And as I reiterate the words of Secretary McDonough, is that every decision I make will be determined by a simple principle that increases veterans' access to care and benefits and improves the outcome for each of them. So I thank you for the opportunity to, we thank you, forgive me for saying that, we as a staff and the agency, thank you for supporting us today. 63, I think, was the high number of people that participated today to learn about the KDVA, and we hope that you take advantage of all the things that we talked about today, and that is your charge. Thank you from the Kentucky Department of Veterans Affairs. God bless and keep each of you. Back to Naida.
Thank you so much, sir. We have had a wonderful time here tonight. Thank you so much for giving us this part of your evening. We hope that you feel that the time had been valuable. Everything that you asked has been addressed. The commissioner mentioned that his family member had served in the Korean War. Please know that if your family member served in the Korean War, there is an Ambassador of Peace medallion waiting for your family member. Please contact us so you can learn about that. If he served in Korea in the Korean War, you see, our information can just keep going on. It can go on and on all night on how the commissioner would like to have us serve you. So please reach out to us tomorrow.